Hello, my Diet Tribe. Welcome to another episode of Let's Talk Diabetes with Nkiruka, where I always share life changing tips through a lived experience lens. So, I'm on the season finale or episode finale of the Diabetes in Ramadan series. Today, I'll be talking about your diabetes medications during the Ramadan fast. So we all know this is a very tricky bit, especially for people who are on sulfonylureas and people who are on insulin. So this is very important that you have a very set discussion with your healthcare professional before you embark on the Ramadan fast, especially in terms of your medication. If the medications need to be swapped with other types of medications that you can use during a fast, then you please do it. So, medications need to be adjusted during the fast because of your fasting times. So, like I just emphasized, it's very important to visit your healthcare provider first before you embark on the fast if you are on diabetes medication. And secondly, you need to start thinking about what you will need to do before taking your medication, like how often you need to be checking your blood sugar levels, whether they're high or they're low or they're on the target range. And the reason for this is mostly dependent on the type of medications that you are on. For some general guidance, I will explain below how adjustments can be made, but I re-emphasize again, you must do this with your healthcare team. So the first medication, diabetes medication I'm going to talk about is metformin. So this oral diabetes medication will not on its own cause your blood sugars to go down. But if you feel unwell with it whilst you're fasting, you can discuss with your doctor on either cutting down on the dose or changing the time you take the medication. So preferably the largest dose could be taken during the iftar. So the second drug I'm going to be talking about is the acarbose. So if you feel unwell with this as well, when you are fasting, consider discussing the dose reduction with your healthcare provider, or preferably you take the larger dose during iftar. And the third one that I'm sure you've heard me talk about, the sulfonylureas. So this class of drugs can cause hypoglycemia, that is low blood sugar, if you do not eat. So please talk to your doctor for specific adjustments or changing the type of medication entirely during your fasting time. The fourth, this is not so common for most people to take living with type 2 diabetes, but this class of drugs known as the SGLT2s, they do not generally cause hypo, but they can cause quite a lot of dehydration. So when you are placed on this particular class of diabetes medication, you need to like keep yourself very well hydrated when you break your fast, and it's best you take it um during the iftar when you're breaking your fast, and keep yourself well hydrated during those during the non-fasting hours, so that you don't get dehydrated. Remember, if you're on SGLT2 inhibitors, you must keep yourself well hydrated when you are not fasting. And remember, you take them when you are breaking your fast at iftar. And there might be some exceptions to some individuals. Some people actually can hypo on this medication. So this is individualistic. It doesn't happen to everyone. So if you find out that when you're taking this medication and on the Ramadan fast that you're experiencing more low blood sugar levels, please, you need to speak to your doctor as soon as possible. The fifth is insulin. So this is very important. If you take insulin to manage your diabetes, please never stop taking your insulin. And it is very, very important that you speak to your doctor for individual advice that suits you as an individual. So what are the risks associated with insulin use and fasting? Number one, you have increased blood sugar levels, which we know as hyperglycemia, and this depends on how you use the insulin and the quantity of carbohydrates you take during the fasting. And then the second risk is low blood sugar hypoglycemia. This is also dependent on activity, the dose. Probably you're taking too little, you're taking too much to match up with your carbohydrate intake, or you're taking little carbs and too much insulin. So it's very important that you have this at the back of your mind. However, most importantly, you need to always check your blood sugar levels on a regular basis if you are on insulin treatment and you decide to fast. In general, during the fasting period, you will need less insulin whilst you're fasting and more insulin when you're eating. So when you're breaking your fast, you need insulin, the right dose to match the quantity of carbs that you're actually eating at that point in time. However, the aforementioned statement will largely depend on the type of insulin that you are using and how you adjust your doses. So this is another topic entirely with carbohydrate counting and insulin dose adjustment. I'll speak about that in another video. So if you're using insulins like the rapid or the short-acting insulin, you can only take it when you eat, and this dose must be matched according to how much of the carbohydrate meal that you are consuming. And this type of insulin actually offers a lot of flexibility, and it's usually taken alongside long-acting insulin. The long-acting insulin can be taken without food and is usually recommended to take during the fasting hours. So this long-acting insulin does not act on your carbohydrate meals, and it is not a type of insulin to be matched up with your meals. It can be taken. It's actually known in layman terms as the background insulin. So this keeps your blood sugar levels in target range during the fasting hours, and it is usually taken without food. So it doesn't cause hypo, but it can cause hypo if your blood sugars are in the hypo range. So you must also check your blood sugars before you take them during your fasting hours, and keep an eye on your blood sugars as well. The next type of insulin, which are the premixed insulin, they are not recommended during fasting. I repeat, you cannot use premixed insulin when you are fasting. Please, you cannot. I re-emphasize, you cannot use premixed insulin during fasting. So guys, remember, you like, share, follow, and subscribe. And I will be ending the Diabetes in Ramadan series with a recap of all I have discussed in all the episodes in the Diabetes in Ramadan series. So just a recap to keep you abreast of everything that I have spoken about, the most important things to look out for during the Ramadan fast and how to prepare yourself. And remember, You don't have to eat too much or compensate on the time that you were not eating with when you are eating. That is a big no. So I'll see you guys in the recap ending of the diabetes in Ramadan series. Thank you. Bye.